Okay, let's just jump right in. We are looking at the ultimate medical paradox in today's explainer. It's this bizarre reality where the very system that ethically mandates you to protect patients is often programmed to absolutely destroy you if you actually follow through and do it. We're going to examine clinical ethics, institutional survival, and, really fascinatingly, how Carl Jung's philosophy maps perfectly onto the agonizing path of the medical whistleblower. Let's look at the whistleblower's paradox, Dr. Srivatsa, and the alchemical journey.
What happens when saving a life destroys your career? If you're a medical student or a junior doctor, you're taught from day one that patient safety is paramount, right? I mean, it's the absolute bedrock of the calling. But the sources we're digging into today ask a really terrifying question about the personal cost of that duty. What actually happens when stepping up to defend the public effectively ends your livelihood?
Take a look at this quote. A physician must report to the appropriate authorities those colleagues who practice unethically or incompetently. Now, the World Medical Association and the General Medical Council strictly require this kind of whistleblowing. But our sources point out a pretty ominous caveat embedded in these ethical manuals. Reporting is almost always framed as a last resort, and you gotta wonder, why? Well, it's because the system explicitly acknowledges the incredible cost to the whistleblower. It leads to almost certain hostility and complete professional ostracization.
There's this incredibly stark contrast between the system's expectation of protected disclosure and the reality of the institutional trapdoor. You have these pristine written guidelines that tell you to pull the safety cord when something goes wrong, the assembly line stops, and the defect is fixed. But the brutal reality of hospital bureaucracy? That red cord is often wired to a trapdoor right beneath your feet. The institution is highly incentivized to just eliminate the person raising the alarm rather than fixing a complex, expensive problem.
To really ground this, we're looking at the intensely documented ordeal of Dr. Kadiyali Srivatsa. Back in 2009, armed with 40 years of critical care experience, he made a protected disclosure to his primary care trust. He raised some very severe alarms about a clinic relying on what he called cookbook medicine. Basically, untrained staff were rigidly following flowcharts instead of actually applying physiological knowledge. And the errors he documented were terrifying. We're talking about stopping a recommended inhaler for a baby or misdiagnosing a severe systemic rash as simple eczema, which led to an immune-suppressing steroid treatment that literally blinded the practitioner to the actual illness.
So you'd think they'd fix those clinical errors, right? No. Instead, the administration breached his confidentiality. They literally handed his safety complaint directly to the very managers he was reporting. This triggered a massive retaliatory playbook. Staff started fabricating claims about his attitude and behavior just to distract from their own incompetence. And then the General Medical Council launched a devastating investigation. The system completely weaponized its own investigatory protocols just to protect their cheaper, nurse-led economic model.
And adding to the tragedy, our sources highlight a profound institutional betrayal from the very union that was supposed to shield him. His British Medical Association representative totally evaded discussing the 99 points of clinical and administrative wrongdoing that he brought forward. They just abandoned him. He was left completely isolated. In fact, he was so terrified of being framed by coordinated staff that he physically refused to enter his own clinic, knowing he was essentially walking into an ambush.
So here's the crucial point. Society and the medical establishment looked at his resulting bankruptcy, his isolation in a room in Germany, and his severe PTSD, and they saw a complete and total failure. But if we look at this through the lens of the legendary psychologist Carl Jung, we get a radically different view. Jung gives us a framework to understand that this destruction, it wasn't the end of his story. It was a necessary transformation.
This builds right into Jung's concept of the nigredo. In ancient alchemy, this is known as the blackening. It's the brutal first stage of transformation where the raw material, or the false self, is burned and dissolved down to its most basic elements. You can't build a new life on top of an old one. The false structures literally have to be burned away. Jung argued that the institutional fire Dr. Srivatsa endured wasn't a punishment. It was a necessary dissolving of a flawed system's illusions.
As Jung put it, man needs difficulties. They are necessary for health, the way oxygen is necessary. He believed that the dark night of the soul is actually the core engine of growth. It forces you to confront your shadow and strip away the carefully constructed identity that was built just to make other people comfortable. Difficulty isn't just an obstacle, it's as necessary as oxygen for true health.
When we track his timeline, we literally see this alchemical fire in action. It starts with the initial spark of his protected disclosure in 2009, and then he descends right into that blackening phase. Punitive sanctions and restrictions hit in 2012, and even when the GMC cleared him in 2013, an administrative failure left the restriction notice up on their public website. That rendered him totally unemployable and bankrupt.
It was a complete dissolution of his past life, but that cleared the way for the emergence of something entirely new.
You see, he didn't fail as a doctor. Srivatsa experienced a rebirth. The sources dive into research on biological inheritance, which suggests that traumatic environments actually alter the epigenome, creating a sort of survival manual that gets passed down through generations. Srivatsa tapped into the 600-year-old epigenetic memory of his Kadiyali Brahmin lineage. These were ancestors deeply connected to the Iluru Kartikeya temple, representing the warrior healer. He reawakened this ancestral dharma to transcend those broken hospital walls entirely.
His guiding thought became, if the system cannot protect patients, how can patients protect themselves? Stripped of his traditional career, Srivatsa shifted his focus entirely. Instead of endlessly defending himself in kangaroo courts managed by laypeople who didn't even understand complex critical care, he asked how to empower the public directly. He took 4 decades of emergency room experience and channeled it into his Dr. Maya AI and Prima kiosk networks, diagnostic systems that operate completely independently of the institutions that dismissed his warnings.
So as a newly qualified doctor, how do you navigate this trapdoor? I'm speaking directly to you, the junior doctor stepping onto the ward today. How do you balance those pristine moral mandates written in your medical textbooks with the brutal reality of institutional self-preservation?
First, you really need to understand the psychosocial trauma responses at play here. When ethical dissonance strikes, you're going to experience a trauma response. Fight is whistleblowing against the system. Flight is ghosting the organization and becoming a bystander. Freeze is accepting the abuse, essentially victimizing or gaslighting yourself. And fawn is actually collaborating in the wrongdoing. The sources explicitly warn that institutions will literally weaponize mandatory psychiatric evaluations to gaslight you and suppress that fight response, trying to label you as unstable just to discredit your clinical evidence.
Navigating this requires a solid survival guide. You can't be naive. Step 1, assess your legal protections carefully. Step 2, gather robust, absolutely undeniable clinical evidence, just like Srivatsa did with those flowcharts. Step 3, strategically select between internal and external reporting channels, because internal channels might just alert the wrongdoers. And finally, Step 4, prepare yourself for the severe psychosocial impact of retaliation.
As Jung said, find meaning in what you suffer and you will ease its weight. To survive the profound psychological toll of whistleblowing, adopting this Jungian perspective is absolutely crucial. The difference between being destroyed by the fire and being transformed by it is your relationship to the suffering. You have to choose to frame the retaliation not as a career failure, but as the fiery crucible forging your true purpose.
So, I'll leave you with this final question. When you are forced to pull the red cord, will you let the system's fire destroy you, or will you let it forge you into something greater? As you don your white coat and step into the clinical world, know that the medical system will inevitably test your integrity. When that trapdoor opens, the choice of what you become is entirely yours.